Um, welcome to all. Bonjour à tous. Welcome to meeting number 7, Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. I regret to inform you of the unavoidable absence of our chair. He has encountered some travel delays, but he should be joining us within the hour. In the meantime, as vice chair, I will preside until his arrival. Today's meeting is taking place in a hybrid format pursuant to the House Order of September 23rd, 2020. The proceedings will be made available via the House of Commons website. So you're aware the website will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I'd like to outline a few rules to follow. Members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen to either floor, English, or French. A reminder that all comments by members should be addressed through the chair. When you are not speaking, your mic should be on mute. With regard to a speaking list, the clerk and I will do the best we can to maintain consolidated order of speaking for all members, whether they are participating virtually or in person. Now to our business. Pursuant to Standing Order 81-4 and the Order of Reference of Wednesday, September 30th, 2020, and pursuant to Standing Order 81-5 and the Order of Reference of Thursday, October 22nd, 2020, the committee will continue our consideration of the main estimates for the fiscal year ending March 31st, 2021, and the supplementary estimates B for the fiscal year ending March 31st, 2021. I would now like to welcome our witnesses. First, the Honorable Deb Schult, Minister of Seniors, and from the Department of Employment and Social Development, Benoit Robidoux, Associate Deputy Minister, Mark Perlman, Chief Financial Officer, Alexis Conrad, Senior Assistant Deputy Minister, Income Security and Social Development Branch, Cliff Groan, Senior Assistant Deputy Minister, Benefits and Integrated Service Delivery Branch, Service Canada, and Stephanie Hébert, Assistant Deputy Minister, Service Canada. Minister, welcome. You have 5 minutes for your opening remarks.
Merci, Monsieur le Président.
Thank you, Mr. Chair, members.
Hang on a minute. I'm hearing myself in the interpretation. Is the interpretation correct? Okay, it's me. I'm the one that's not right. Sorry, I'm going to start again. Merci, Monsieur.
Thank you, Mr. Chair and committee members.
Thank you very much for inviting me to speak about the 2020 and the 21 main estimates and supplementary estimate B for Employment and Social Development Canada as Minister of Seniors. It's a pleasure to be here and also to be here with my officials. As Minister Qualtrough and Minister Hussein shared with you a few weeks ago, the main estimates for 2020-21 represent a total of $68.6 billion in planned budgetary expenditures for ESDC. This is a net increase of $3.8 billion over the 2019-20 main estimates of $64.8 billion. This is primarily due to normal increases in the number of beneficiaries of old age security and the guaranteed income supplement, as well as inflation adjustments. In the supplementary estimates, ESDC is requesting $1.2 million related to government advertising programs, and this funding will support 2 advertising campaigns. One will raise awareness of federal programs and services that benefit seniors, and the other will support accessibility in the workplace for persons with disabilities. Ensuring seniors are aware of their benefits and the benefits that are available to them is vitally important, especially during this pandemic. And these programs will help keep seniors informed. En tant que ministre,
as Minister of Seniors, it is my responsibility to ensure that programs and services from the federal government respond to the needs of seniors.
Provide Canadian seniors with greater financial security and quality of life. We restored the age of eligibility for old age security and guaranteed income supplement to 65. We increased the guaranteed income supplement for single seniors and increased the earnings exemption. We increased the Canada Pension Plan's maximum yearly benefit for future retirees by about 50%. It is well recognized that the pandemic has brought stress and challenges to Canada's seniors. In response, we put in place a number of measures to support seniors' financial security and well-being during these challenging times. In April, we provided a GST credit supplement to over 4 million low and middle income seniors. And in July, we provided a one-time payment to seniors eligible for old age security, plus extra support for those eligible for the guaranteed income supplement. Through these measures, we provided about $900 for low-income single seniors and over $1,500 for low-income senior couples, all tax-free, in addition to their existing benefits. Through the New Horizons for Seniors program, the federal government funded over 2,000 community projects across the country to support seniors. Many of these projects have helped seniors connect online for the very first time by providing tablets, low-cost internet access, and help on how to use them, and then group activities like exercise classes and meditation. Others help seniors continue to access critical services like medical appointments and access food. Furthermore, we temporarily extended the guaranteed income supplement and allowance payments for seniors who couldn't file their income information on time. While long-term care facilities fall under provincial and territorial regulation, we invested in infection prevention, wage top-ups, PPE, and opened up federal infrastructure funds to long-term care homes. Looking forward, our government will work with the provinces and territories to set new national standards for long-term care so that seniors can get the support they need. We'll take additional action to help people stay in their homes longer, and we remain committed to increasing old age security by 10% once a senior turns 75. Je vous remercie.
Thank you for giving us this opportunity to explain the measure that we are doing to fulfill our commitments.
To respond to your questions. Thank you.
And thank you, Minister. We'll proceed to the first round of questions now. 6-minute round. Ms. Falk of the Conservative Party.
Thank you, Chair, and thank you, Minister, for being here today. So, I mean, we all know that seniors have been particularly hit very hard during this pandemic, you know, whether it's social isolation or to health. It's been a very difficult year. And we know even more so for seniors that are living in long-term care facilities. But, you know, these challenges that are in long-term care, they're not new challenges. So this committee actually has a report from the previous Parliament called Advancing Inclusion and Quality of Life for Seniors. And there was a number of recommendations to address this issue in it. And we do know that there's been outbreaks happening, continuing. Now we're in the second wave, fatalities are on the rise, and that there's a need for immediate action from every level of government. And every level of government does have some type of jurisdictional responsibilities. So I guess my first question, chronic understaffing, recruitment and relation is a major concern in long-term care. So Minister, I'm just wondering, how are you working with the Minister of Employment, Workforce Development and Disability Inclusion to address the labor shortage?
Thank you very much for that question. And we are very focused on supporting the provinces and territories in helping them to deliver healthcare during this pandemic and to make the system more robust for infection and prevention.
Are you working directly, though, with the Minister of Employment, Workforce Development and Disability Inclusion?
Yes, Minister Qualtrough and I are working within the committees that we have set up to help work on issues that are being addressed in this pandemic. So yes, we are both on the committee. We've been working since the spring, well, since the pandemic was declared, to work together on a multitude of initiatives. And one of them, obviously, we are aware that the workforce of PSWs is not adequate, and that there was a shortage, and that was causing stresses.
Has there been actions to address that?
Yes. So just so that you know, we provided funding to the Red Cross, and the Red Cross has been working.
But for staffing particularly?
Yeah, no, particularly in staffing. They have been training up people to be able to fill PSW roles in long-term care.
So
and
Red Cross is training
Red Cross.
PSWs?
We have provided funding to Red Cross, and this is a multi-level approach to support. Provinces and territories are doing it. We are also supporting them through the Red Cross in long-term care facilities, and Red Cross is training up people to be able to go in and fill those positions. And as you see in Sub-Bs, we've also been working to make sure that we also are supporting getting more PSWs into the system. So that's in our
so how many PSWs have been trained?
So we have just got the authority to move forward on this in September. So we're working to rapidly to ramp that up.
Happened? Has it?
Well, I know that you've had good discussions already with Minister Qualtrough on this at previous. Maybe what I could do is turn it over to the officials if you like to get some more details.
That's okay. I can follow up with them in the next round. I just have a question, Minister, for you regarding your provincial counterparts. Have you met with them thus far during the COVID-19 pandemic to discuss long-term care in specific?
The long-term care specific discussions are occurring under the Ministry of Health PT table, and so they're having those discussions almost weekly. I am following up on other initiatives to support seniors with my counterparts, and we've met one time already, but I've had many phone calls, and just recently had one yesterday with Minister Pon in Alberta as we're preparing for our next meeting next week. But we are in constant contact. I'm getting texts and emails, and I'm making phone calls to my colleagues to make sure that we're there to support seniors during this very challenging time.
Thank you. And Minister, I have had the opportunity to speak to many individuals working in long-term care and groups that represent those that do. We do know that the throne speech included a commitment to explicitly penalize those who neglect seniors that are under their care. And some of these groups have expressed a serious concern with long-term care workers being vilified for care standards that are impossible to meet, given the lack of resources and supplies that are provided for them. There's a concern that this would actually only further make recruitment and retention in the long-term care sector more difficult and ultimately lower the care that is available to them. So, Minister, I'm just wondering if you are aware of these concerns. And if you have you brought them forward to the Justice Minister?
So thank you very much for that question. And yes, I am working closely with my counterpart, the Justice Minister, to look to make sure that we are strengthening the
to criminalize workers?
Well, no, it's to make sure that we hold people accountable where they have
right. But Minister, if there is not proper PPE and if there's not proper supplies that these PSWs, nurses, whether it's LPN or RNs need to do their job, isn't that actually setting them up for failure and for criminalization if that's the route that your government decides to go?
So there's no intent to set anyone up for failure. The intent here is to hold people accountable for willful neglect and abuse of seniors. And what we have done is made sure that we do have PPE going to the provinces and territories, and they're distributing those to the long-term care facilities, making sure that we have helped bolster to have the resources in terms of the employees, the PSWs that are required to be in the system, and providing additional funding for a wage top-up, because we know that the wages are an issue and that they need to be addressed as well. So we temporarily, in the pandemic, wage topped up to make sure that we had the resources that were needed in those facilities to help strengthen the response. Thank you.
Thank you, Minister. Thank you, Ms. Falk. For the Liberals now, Mr. Dong, 6 minutes.
Well, thank you, Chair Ken. It's great to see you at the chair seat, and yeah, thank you for doing a wonderful job so far. And I want to talk to the minister about the New Horizon program. It's not a new program. I remember it was created under Prime Minister Chrétien's administration, but it has done a wonderful job in the last little while. And I know in my riding, there are a lot of active senior groups and service agencies that benefit from this program. And they have been very innovative facing the pandemic. And I've been reaching out to them, hearing a lot of positive feedbacks on this program. So can you speak, first of all, to the specific measures that you put forward that positively affect the seniors and also the organizations by applying and receiving this New Horizon program?
Thank you very much for that question. The New Horizons for Seniors program has been incredibly effective on the ground in communities helping seniors. And we made sure that the resources were there, additional resources were there. We allowed organizations to pivot during the pandemic in the projects that they had been funded for, so that if they could step up and deliver for seniors, and many did step up and help provide food, provide resources, access to important doctor's appointments, and to make sure that they addressing isolation, providing tablets and support to using those tablets and programs. And I could tell you many stories. I've heard from lots of colleagues on both sides of the aisle that have told me how important this program has been in their communities. So we were able to support over 2,000 projects this year in all corners of Canada. We also provided an additional $9 million to United Way Centraide to be able to also support through their networks. And through the 350 emergency community support fund, they've also been reaching out to the more vulnerable Canadians, including seniors. And I've seen that money also flowing in communities to help support our seniors. So it's been an incredibly positive program. And as you know, we've made some changes to even enhance it further. And so I'm looking forward to the intake is just closed in October, and we're looking to review those programs and get them going early next year. Thank you.
Thank you, Minister. And you mentioned that you saw or heard that there are stories or evidence that these organizations and service delivery groups, that they actually pivot their program in the context of the pandemic. Can you share with the committee some of the evidence and some of the stories that you've heard where they made changes to help seniors Canadians during this pandemic?
Absolutely. I have a group, just an example in my riding, called Human Endeavor, and they run a HOPE program where they used to bring seniors together. They had over 50 seniors that regularly came together for exercise programs and support programs. They pivoted quite quickly, provided tablets and devices, did work a program with a provider to give low cost access to these seniors, because it's not always about having the tablet, it's about having the internet access that they need, and sometimes that is a cost barrier. So they provided that, and they run programs I think it's 7 or 8 times a week, and they have over 1,000 people now signed up. So we went from a very what I would say smaller, maybe 50 to 100 people, and now they're up to 1,000 because of the incredible programs that they're being able to deliver from support from the Government of Canada to make this possible. So if there's a silver lining, which it's very hard to say that there's a silver lining in the pandemic because it's been so horrific, but if there's anything, it's allowed seniors to find other ways to connect and get the supports that they need. And they've been able to use those resources to not only connect with those programs, but also with family overseas and around the world. So it's been a very, very powerful program.
Great. Minister, earlier on I heard my colleague from the Conservative Party asking questions around the long-term care facilities and PSWs. But not only the seniors at those facilities are facing great challenges and a lot of times life-threatening situation, but also seniors in our community and our riding, despite the fact that they've seen additional top-up or income coming from federal government, but they are still facing a lot of challenges. I hear a lot of seniors telling me that their daily routine had to be changed. The support they used to get is no longer there, or it's being decreased. So they need that additional income support to help them. And can you talk about the importance of overlapping with those additional support and what your funding coming out of your ministry and how important those funding were to help seniors to get through this pandemic?
So thank you very much for that. You're absolutely right. It's not just about providing resources in the community to support seniors, but it's also about giving seniors additional support directly. And as I mentioned in my introductory remarks there, we were giving seniors a one-time tax-free payment of $300 for those on old age security, and an additional $200 for those that were receiving, the more vulnerable seniors that were receiving guaranteed income supplement. And for a senior couple that are on guaranteed income supplement, they would have received over $1,500 to help them with the additional costs during the pandemic. So in addition,
Minister. Thank you, Minister. We're at time, and thank you, Mr. Dong. Maintenant, pour le Bloc québécois, Ms. Chabot.
For the Bloc, Madame Chabot. Thank you, Mr. Chair, Acting Chair, and Madame the Minister. I'm very pleased to see you, and thank you for taking the time. I heard your remarks, and I have two questions. I think we can all agree that in this particular period we are going through with the pandemic and with the COVID-19, that our seniors are having a hard time financially and in terms of health. My first question is, I know that even if you have discussion with all your colleagues, you know what is happening in terms of health at the caucus. And I hear of lack of standards. We know that the solution is not there. The health is exclusively from the provincial jurisdiction, and if we need to support the needs of our seniors, it has to be a better or an improvement of the transfer, and all provinces agree on that. So, as Minister of Seniors, very close to the Minister of Health, do you have any works that will help with this solution to this incredible problem?
It is a pleasure to be here with you all today. You're absolutely right. Our focus has been on the health of Canadians, especially during the pandemic. And what we have been doing is working very closely alongside the provinces and territories to make sure that as they've identified where their needs are, that we have provided the resources, and we've provided it not just in money, but in actual resources. And the extreme example is the Canadian Forces. When there was a crisis in some of the long-term care homes, we stepped up and provided the Canadian Forces, and then we supported the Red Cross to also be there. So I just want you to know we're not, and we supported with personal protective equipment.
Thank you, Madam Minister. But I had a question on the health transfer from the federal. Can you say something or support this health transfer?
The purview of the Minister of Health. So what I'm trying to explain is that right now we have been supporting the the premiers, they've been identifying what their needs are in additional money. We've been giving additional money from early in the pandemic to help make the health system more robust. That was part of the $19 billion of Safe Restart money, and 740 of that went specifically to help more vulnerable Canadians and in long-term care to help those systems to be more robust. And that could be with resources of staffing, with protection, prevention protection, PPE. These are the kind of things that was identified that were needed, and we stepped up with additional money and also resources in contact tracing and testing and in the military and the Red Cross. So we have been there not just in money, but in resources as well, to be standing with the provinces and territories, supporting them as they deal with delivering healthcare to Canadians in this pandemic.
Je comprends que la réponse est non, que vous en êtes pas là, que ça a été des...
I understand that the answer is no, that you had solution to answer short-term problem, but not long-term issues. So I have another question. I would like to talk about the financial difficulties that the seniors are in. I do not have time to give you all the numbers, but you probably know that sole person, especially women, that with the old age security and GIS is barely $10,000 a year. It's not even in the average to be able to have the services for even for their dignity. We should already augment the old age security, the GIS since the age of 65. Are you ready to support this in the short term? There was only $300 on the OAS, but I think the seniors were left alone, because I'm saying this because I think they need some protection, some social net protection. Are you ready to give them this aid on the long term?
Thank you very much. I really appreciate your comments and your question, and I'm hearing the same thing from seniors and senior stakeholders across the country, that seniors need more support, which is why you heard in the throne speech that we are continuing with our recommitment of increasing the old age security once a senior turns 75. And we have obviously focused right now on the pandemic, making sure that seniors get more supports directly and also through the community. And I just want to repeat that with the support we gave over the summer, with the one-time payment to OAS and guaranteed income supplement, and addition to the GST credit, that was giving seniors seniors on guaranteed income supplement, a couple over $1,500 tax-free to help them. So I recognize that this is now.
Thank you, Minister.
And we need to look for the future. Thank you.
Merci, Madame Chabot.
Thank you, Ms. Chabot.
Ms. Gazan.
Thank you so much, Chair, and thank you to the Minister for being here today. Lions Place in my riding has recently had their 35-year federal housing subsidy agreement come to an end, which included a rental subsidy for seniors. Many seniors who I've spoken with, who even with the rental subsidy were choosing literally between medication and rent, who are now worried about being on the streets. The provincial government in Manitoba, unfortunately, has yet to sign the agreement with the federal government to get dollars flowing under the National Housing Strategy. We have found other ways, other avenues to get money to people in our community, considering the behavior of the current Conservative provincial government. Are you going to find different ways to address this? Or are you going to continue to leave this so that seniors in my riding, seniors who deserve to be treated with dignity, end up on the streets?
So thank you very much for that, raising that important question and that important concern. We know that housing is a fundamental necessity for security for Canadians and for seniors. And so we know every senior deserves to have a dignified place to call home.
Just because of limits in time, I think we all can agree that everybody should have a house and live in dignity. So my question, I'd like you to answer my question. Do you have any plans in place to ensure that monies are given to ensure that seniors continue to get rental subsidies so they don't end up on the streets?
So our programs that we have been working, obviously you've mentioned, we've been working through the provinces and territories to provide through our national housing strategy. But through the national housing strategy, you don't have to have the province involved. You can, in some of the streams, you just need to have a really good project and be able to come forward with that. So we've been working with municipalities, with not-for-profits and organizations to be able to bring forward great ideas that will help us.
So just because this is a dire situation, will you commit to working with the seniors at Lions Place to ensure they have what they need so that they don't end up on the streets?
So what I would like you to do is bring forward that particular request to me, the details. We will take a look at it and see what we can do to assist. But we have the national housing strategy that is there to help.
So just because I have other questions, so your answer is maybe, and I will follow up. I appreciate that.
Thank you.
Okay, so in August, I submitted a motion to convert the CERB into a permanent guaranteed livable basic income. And this is an idea, as many people around the table know, that's supported by the majority of Canadians. And we already have guaranteed income programs, for example, GIS. We know, however, it's not livable. And, I've been bringing that up a lot recently, particularly with the extra costs that seniors face in regards to pharmacare. Are you committed to supporting a universal pharmacare program? Are you in support of a universal pharmacare program to ensure that seniors get the medication they need and don't have to choose between medication and rent?
Absolutely. That is a decision or a choice we don't want seniors to be having to make. We don't want any Canadian to have to be choosing between trying to take their drugs and put food on the table. So yes, through the throne speech.
Sorry, just because I have limited time and I'm quite concerned about seniors in my riding, will you vote in favor of the universal pharmacare bill being proposed by the NDP?
What we have committed to is, in our throne speech, is to accelerate steps to achieve a national universal pharmacare, and that's what I'll be working hard to provide.
With all due respect, Minister, we've been waiting like 30 years for the Liberal government to put in place pharmacare. I think seniors have been patient enough. Certainly seniors in my riding who are literally not taking medication so that they don't end up on the streets. That's the point it's at. So, Minister, we know that seniors have been the most impacted during the pandemic, which is why, in light of everything that they are facing, including mental health impacts as a result of social isolation.
Thank you, Ms. Gazan.
Okay, sorry.
You're just
I have
over
a million questions. Thank you, Minister. Thank you.
Thank you. Moving now to the second round of questions, 5-minute round, beginning with representing the Conservatives, Mr. Schmel.
Thank you very much, Chair, and thank you, Minister, for your comments today. Minister, I understand there were some changes to New Horizons due to COVID-19, and recipients could use funding from 2018 through 2019 on other activities not previously approved in response to the pandemic, as long as they were on eligible activities. Can you provide details on how much money was redirected to these eligible activities? And can you comment on how the department makes these decisions on changes and how it is monitoring the effectiveness of these changes?
So thank you very much. We allowed organizations that received money in January, so that was 2019, 2020 money, to be able to look and see how they could modify their programs. We had a series of potential opportunities that they could modify to deliver, and that would be including helping with transportation of seniors to necessary appointments, to being able to connect them with devices, to be able to even get volunteers, pay volunteers, because we know many of the volunteers were drying up because volunteers are often seniors and they were staying home. So to help get services, to be able to pay volunteers. So there was a series of things that we had not done ever before that allowed these organizations to change their programs to be able to deliver in a pandemic environment. And what I'll do is I'll just turn it over to the officials to give you the actual numbers, because I don't have the numbers in front of me right now.
Actually, do you mind, just for time, I'll just follow up with them in the next round, if that's okay, Minister, but I will ask them the same question, give them time to prepare. So I noticed on your website, Minister, that a proponent needs to follow up on a proposal through an online form, if I'm correct. There are no service standards mentioned on that page. I trust there are some, or even if there are, which I assume there are, what are we using? What are the service standards that you're using to respond to these requests?
So what we're looking at is a number of seniors served, how well they are meeting the intent of our program, and so that's what I think. I'm not quite sure what exactly you're getting at, but we are in terms of allowing them to proceed with delivering a change in the program from the one that they had been approved to deliver. It was how well are they able to meet the new criteria, how many seniors are they going to be able to support, and then we basically approved them to move ahead and make that change and deliver.
Okay.
But I think what you're talking about is going forward, or are you talking about the past? That's what I wasn't quite clear.
I could do more in the past with regards to proponents needing to follow up.
Because what you're seeing on the website now is the going forward, right? So.
Okay. Perfect. Thank you. Minister, an organization in my riding, Globus Theatre and Bob Cajun, has been trying to get information from your department for 2 intakes now. In an email to me, they state, and I quote, "We have been trying to get an answer from the department for quite a while. It's too bad. We would love to provide more opportunities for seniors at Globus Theatre, so this would be a great program for us. I wish there was more communication from that department," end quote. And it is really too bad. Their message does ring true. It is a great organization. They do a lot of great work for seniors and the community at large. So, Minister, I guess, are there any plans to make it easier for proponents to contact your department, COVID or no COVID?
Absolutely. I am very disappointed to hear Bob Cajun's having difficulty connecting with us, because I have been hearing lots of good alternative stories from people that have been having excellent service from our department in terms of being able to get answers to questions. So why don't you make sure that I get that detail from Bob Cajun, and we will get back to them and let them know what they can do to help strengthen their applications to be successful in the future. That we hopefully help them to be better equipped in their application to be successful. Thank you.
That's very kind of you. Thank you, Minister. I do appreciate that. So, Minister, as was mentioned in earlier questioning, we all know about isolation during COVID-19. Rural internet connectivity is coming up all over the place, and it affects people of all ages. Seniors, the ones that are feeling isolated the most in many cases. I know you're aware of this. You recently took part in a town hall with some of your colleagues. We heard it in earlier questioning. We have a serious problem. Can you tell me what your department is doing to raise this issue on behalf of seniors with other ministers within your government?
Well, thank you very much. I can tell you that I sit on several different caucus with my colleagues, and we make this issue is raised. We have had a good response with the minister who's responsible, Minister Monsef, and recently there was an announcement of some excellent funding for the Universal Broadband Fund, and having a quick stream to have short-term solutions and then a longer-term solution, and we put additional funding as a government in it because we recognize how incredibly important being connected is to be able to have good health services, education services, and for seniors, social services too.
Chair, how much time do I have?
Just over a minute, Mr. Schmel.
Perfect, thank you. So Minister, we're glad that there is now a Minister of Seniors in the government. Unfortunately, it took a while from 2015 to get one, and we're glad there is one in place now. So I've had many constituents, including Marie and Keith Trainer from Lindsay, contact my office to express their very deep concerns regarding the lack of support for seniors during COVID-19. We heard little in it, the throne speech in regards to seniors, a few re-announcements, that type of thing. I think we all can agree seniors have been paying taxes their whole lives. They need to live in their golden years without worry. I guess seniors want to know if the government has plans to increase the age credit to put more money in their pockets, and is there anything in the works to protect pension funds by requiring federally regulated companies to report on fund solvency?
Okay, thank you very much. There's quite a lot in that question.
There was.
I just wanted to just re-emphasize what we did put in the throne speech that is important to seniors. So obviously we are recommitting to that old age security increase once a senior turns 75. We're going to take action to help people stay in their homes longer. This is an important initiative that I hear from all across the country, that people don't want to go into long-term care. They want to stay in their home. So we're going to be working on additional actions to help with that. Obviously, we're working with the provinces and territories to set new national standards for long-term care. We mentioned about accelerating steps to achieve that national universal pharmacare, and we're going to bring forward a new disability benefit that's modeled after the guaranteed income supplement. That's going to help. Sorry.
Thank you, Minister.
Thank you.
Thank you, Mr. Schmel.
Lots to say.
To the Liberals now, and Mr. Turnbull, 5 minutes.
Thank you, Mr. Kent. Minister Schuld, it's great to see you, and thank you for being here this evening or this afternoon. I know we can always count on you for your genuine commitment and authentic leadership, and I have a few questions for you. Minister, while I know you work with the Minister of Health and closely with provincial and territorial governments, the COVID-19 situation in long-term care homes and senior homes across the country has perhaps been the most significant pandemic kind of wake-up call for us as elected officials and for leaders at all levels. Canada's seniors deserve the best care after a lifetime of hard work. I'm sure you agree. Right now, seniors of today and tomorrow are looking at the system that is designed to support them as being kind of full of cracks. Folks in my riding, including my local seniors council, say that this is one of their top issues. So I wanted to ask you, can you tell us what the federal government is doing with partners at all levels on this topic?
Thank you very much, Ryan. And I really do want to let you know that this is very close to my heart. I had my mother-in-law in a long-term care facility, and she passed away in the summer. And I have my father-in-law in a seniors residence. So I am very, very aware of the challenges that Canadians are facing with their loved ones in these facilities. And I am as shocked and as outraged as all of you to what we've learned has been going on in terms of the lack of care for seniors, especially with the crisis of the pandemic. So you have our commitment that we will and are working with the provinces and territories to establish long-term care national standards, okay? But what's really important right now that it sounds like rhetoric, but it's not. We need to be working with them right now. They're on the ground. They have jurisdiction over health delivery and over long-term care. They are not the same across the country, right? Right now, we need to be working very closely with the province. Make sure we're giving them the resources that they need. They are aware what they need to do. They are working hard on it, I know. And so we've been supporting with PPE, supporting with wage subsidies, supporting with training personnel through Red Cross and through what you already are hearing in SUPBs. We're going to be continuing on that important work to make sure that we have enough resources, enough people trained to be able to go in and support our loved ones in these facilities. We also provided funding through the infrastructure program to be able to do upgrades in long-term care, and to be able to do it through the Safe Restart funding of $740 million. So we've provided a lot of money and a lot of resources to the provinces and territories to beef up their long-term care facilities and better support the seniors that are living in those. But there's lots more to be done. We are working very closely with them. And when they are asking for more support, which they are doing again, we are there. And we are going back in with support from the military where it's being requested and where it's required. So we're there. We have been there all along, and will continue to be supporting our provinces and territories to deliver. But we also will be working with them on creating national standards. But right now, it's a pandemic time. It's all hands on deck, and that's what we're focused on doing.
Thank you, Minister. That's reassuring for people like my mother that are in long-term care as well, so I can relate. So another question related to mental health, which has come up a lot among my seniors council members. Minister, do you have a message for the seniors, their families, the provinces and territories as we go into a challenging winter? It's been 8 months at least, which has strained everyone's mental health, but none more than seniors who are isolated and have been isolated for long periods of time. What can we do to connect with folks, the seniors that are out there? They need our help more than ever.
Thank you very much for that. You're absolutely right. But I do want to send a message to seniors, your loved ones. There is light at the end of the tunnel, but we need to recognize that we're not there yet. So we still have to be in implementing and holding on to those public health measures that we're being asked. Keep a safe distance, keep your family circle close, wear a mask if wear a mask. I think that's pretty much a good message. Wear a mask when you're interacting with other people. Keep yourself safe, keep them safe. Wash your hands frequently. These are things that we need to keep doing. And, where you have a device, download the COVID app, because it will give you information whether you've been close to someone, and then you can go get tested. We need to make sure that we have the resources to keep people safe. We are continuing, as I said, to work with the provinces and territories, but be hopeful. We are very hopeful. We are working very hard to deliver the resources that people need, and the vaccines, when they are certified safe, we will then have the mechanisms in place to deliver those as well. So I just want to send a message to be hopeful. There is light at the end of the tunnel, but please be careful. And that's what we need people. Don't let your guard down now. We really need everybody to pull together. Thank you, Ryan.
Thank you, Minister, and thank you, Mr. Turnbull and colleagues. Minister, I see that our chair has landed, so I will return our virtual gavel to Mr. Casey. Sir.
Thank you very much, Mr. Kent, and thank you for so ably fulfilling the duties of the Vice Chair. And it appears that everyone is still getting along, and so by any measure, that's a resounding success. Thanks again. So if Mr. Turnbull is done, the prochaine.
Next is Ms. Chabot. You have 2.5 minutes. Ms. Chabot, the floor is yours. Thank you very much, Mr. Chair. Minister, a small comment for you. These national standards for long-term care facilities, you have repeated that tonight. Well, in Quebec, the answer was clear. We do not want to have national standards for long-term care homes. It's a provincial jurisdiction. What we want is a higher health transfer that will allow us to meet the needs of our population, because people are getting older. Now, let's talk about GIS. You probably know that those who receive GIS are those who have the least. They have about $18,000 per year. They are surviving. In May, at HUMA, the Canadian Association of Retired People, suggested that we should not use emergency funding in the GIS. So do you agree with that?
I'm not sure I understand. I think I don't know if the translation didn't come across properly or what, but I'm not sure I understood the question. So I don't know. I'm quite fine if you just want to turn the clock back and have the question asked again, because I don't think I understand the intent of the question. If you don't mind.
Yes, I will ask again. You know that the GIS, when you receive that, is because you're very poor, and it's based on on what you earn in the past year. But because of the pandemic, a solution was suggested by an association, and this is the solution. So for those who receive emergency benefit, they should not count these benefits to determine their GIS amount next year. So do you think it's a good possibility, a good solution?
I understand the question now. Thank you so much. And I think the benefit that, because what I was trying to get at is the benefit that we provided to seniors in the summer, we made sure that it was tax-free, so that it would not impact on any of their benefits. So that's something that we were very careful to make sure that the benefits that we provided seniors through the one-time payment and the GST credit were not taxed, which means that they wouldn't affect their GIS payments. Because you're absolutely right, those that are on guaranteed income supplement are our most vulnerable seniors. But I understand, I believe that you may be referring to other benefits that have been provided by the government, and we are still looking at how those other benefits interact. So we'll see what the implications of those are, and we'll have more to say in the near term. Thank you.
Merci, Madame la Ministre. Merci.
Thank you, Ms. Chabot. Now, Ms. Gazan.
Please.
Thank you, Mr. Chair. It's been a national tragedy seeing the number of deaths in long-term care homes, including in my riding, where Parkview Place is located, a Crown corporation. We know that seniors are not disposable, but they've been treated like that. And we've seen that during the pandemic. I have families in my riding that are trying to get their family members out of the long-term care homes to be with them at home, to try and save their lives. But unfortunately, they don't have adequate supports. You mentioned that your government is in the process of putting together a plan to provide more support for seniors wanting to live at home and to live closely connected with their families and community. I want to know a date when that plan will roll out and what is the dollar figure attached to that plan.
So thank you very much for the question. I know that you're quite aware that our government back in the previous term had negotiated with the provinces and territories and a bump up, or not a bump up, but a negotiated agreement for $6 billion to flow to support improved home care and mental health across the country. So this is something that we are obviously very much wanting to see delivered through.
So my question is, because I only have two and a half minutes, when? Like, I need a date because people are currently passing away from COVID in my riding. So right. I'd like to respect their concerns and give them a date.
So that money is already out to the provinces and territories, and that has flowed, and they are delivering those enhancements to the service. For us, what we've been doing is making sure that we are supporting people in their homes through the New Horizons for Seniors program in the short term for the pandemic, and also supporting with additional funding to the provinces and territories through the Safe Restart program, $19 billion.
How much money has been, just because I'm almost out of time, how much money has been provided to Manitoba, Winnipeg specific, through the New Horizons program, as our province, and certainly the city of Winnipeg and Rivera facilities more specifically in long-term care homes in northern Manitoba, have been really seriously hit. I want to know a dollar amount. And because of the crisis, are you planning to provide more to ensure that seniors are safe and can survive the pandemic?
So there's a variety of different programs that are being provided. So I will turn to my officials to see if they have that information in front of them right now. Otherwise, we'll make sure that we get that information to you. But just for an example, one of the things that we have been doing through the program is providing some of the long-term care facilities with tablets and devices to help seniors connect with their family members and stay connected. So there's a variety of different programs. That's not the home care that you were talking about, but it is ways for us to be able to improve the connections. And
I'm not talking about that.
Thank you, Ms. Gazan.
Okay,
You're well past time.
Oh, thank you.
Thank you, Madam Minister. Next, we have Mr. Schmale for the Conservatives for 5 minutes.
I believe it's Brad Viss.
Go ahead, Mr. Viss. You have the floor.
Thank you. Minister Schulte, it's nice to see you as always. I thought about you last night when I wrote a speech on Bill C-57. Hasn't been enforced yet, but I remember our fond work together in 2016. The first question, just for clarification, you mentioned the National Housing Strategy. Are long-term care facilities able to apply for funding under the National Housing Strategy?
That is an excellent question. And the answer is yes. However, it is a bit more complicated because they have to have approval from their provinces for those beds, because the delivery of healthcare is the provincial jurisdiction. But there's a portion of the long-term care which be deemed to be housing.
So it would be dependent upon whether or not there was a provincial federal agreement in each respective jurisdiction.
It would be dependent on whether the jurisdiction in the province is providing the support to those long-term care beds that are being intended to be built. So that's the step that you need to make sure that you have the support from the province, that they're going to fund the healthcare portion of that long-term care facility.
That's very helpful. Thank you. I noticed in the 2020-2021 departmental plan that there was going to be funds made available to help seniors understand the benefits that they're entitled to. I would add that just recently, my mother-in-law, she's in her 70s, but she's still working. She's an immigrant from the Philippines. And we had to help her do her new EI application under the new system. For a woman whose third language is English, even though she's been in Canada for over 30 years, that was a very complicated process. And I would just encourage the department to look at ways we can improve the delivery of those services. They need to be comprehensive, but it is super challenging. My wife and I had to get on, and I, as a member of parliament, it was challenging. So I would encourage the department to look at that very closely.
Can I just ask that you share with us the observations or the interactions that you had, because we are always looking at ways to try and improve access, and not everybody's going to be able to access online, but where they do, we want to make it better. And so we did those changes with the New Horizons for Seniors program, because we know that had challenges. We're always looking to make it better. So please share with us what your experiences were so we can do that.
Yeah, on EI and as it relates to the Canada Pension Plan and figuring out those intricacies within the application, where it was very, very challenging for a senior whose first language wasn't English or French and was having to complete these forms. So I think the department could do some good faith work to improve that, but I can follow up with you on that. So just looking, we are here for the estimates. And I noticed on the Library of Parliament briefing that we got, for 2020-21, there was a total voted spending of close to $4 billion, total statutory spending of close to $65 billion, and total budgetary spending of close to $69 billion. Those are huge sums of money. So I don't expect you to have an understanding of where all that money goes. But where do you think that if you're looking at it from the perspective of a taxpayer, where's one area in ESDC that we could look or that you've noticed might be able to do just a better job with the federal funds that they've been allocated?
Well, I really appreciate you asking that question, because if you, and you have, I'm sure, looked into the main estimates, we're talking $68.6 billion in planned expenditures for the main estimates. And you're going to wonder, that's a heck of a lot of money. But if you looked at it, you would see how much of that is actually going to OAS and GIS. And it's a significant majority of the funding is going to support our seniors. And I think people really need to look at that, because we talk about making sure that we give more, and we are always looking for ways to continue to help seniors. But we need to also be aware of how much of our tax dollars are going to support our seniors with these really important
Thank you. I'm going to cut you off there. And I do understand the difference between the expenditures directly on Canadians, but maybe I'll rephrase it. Which department within ESDC, according to your judgment, it's the largest government department, which department at ESDC is not living up to its standards and doing a good enough job on behalf of taxpayers?
Madam Minister, we're out of time.
You gave the NDP a little bit more time. Come on, that was a fair question.
Madam Minister, I'd like you to respond to it briefly, please.
Thank you, Chair.
I want to assure you that all of our colleagues and the departments have been working extremely hard this year, in addition to past years, to make sure that we're there to deliver for seniors. And of all years, we should all be very grateful for the hardworking officials and public servants that have been making sure that these services have been delivered. I mean, we really had very minimal problems with our seniors programs and our seniors payments. And I think, 6.7 million seniors got an extra bonus
so
to
everything
help them
in the department is 100% A-OK, and no need for the Auditor General to get those funds they really need, because nothing's wrong at ESDC. Thank you so much, Minister.
Thank you, Mr. Viss, and you're welcome. Next, Mr. Lauzon, s'il vous plaît, pour 5 minutes. Et Louis.
For 5 minutes. And he'll be the last person to ask questions, Mr. Lauzon. Thank you for being here, Madam Minister. It's always a pleasure to see you and to hear you talk about seniors with such a passion. What is significant is the emergency we have, the measures to be taken. And we know that you are touring Canada in a virtual fashion, but you did that during the pandemic. And according to the seniors you have consulted, what were their the most often expressed concerns of them? And what are the priority objectives of the government that we should implement?
And also for your support in doing those virtual town halls and tours across the country. It has been a fantastic opportunity to connect with stakeholders and with seniors and listen directly to them, and having them share with me their concerns and their issues. Financial security is one that we hear a lot of, but the one that I actually heard the most about was social isolation and mental health, and getting connected to their family members while they were being asked to isolate at home and stay safe. And so this is why our New Horizons for Seniors program we asked for additional funding, and we got it to be able to make sure we could give even more support to those in their community through the groups that know who's vulnerable in those communities and needed the help. And I've already mentioned about some amazing programs that communities have done to connect with those seniors and to make sure that we don't leave anybody isolated at home without the connections that they need stay safe and stay healthy. The mental health, I just want to make a call out because it is important to mention what the government had done. We provided a new Wellness Together portal that people can connect with to get advice, to get the help that they need if they're struggling with their mental health. This is transformative, and it's a very powerful tool that Canadians now have for them to be able to connect with. So that's just a little bit about what I've heard and where the government has been responding to help seniors, specifically follow the public health measures and stay safe and stay home.
Vous avez vu la ministre plusieurs.
Did you see the New Horizon project come on the table? And we saw that there were many requests for tablets just to break the ice, to be so that they are not feeling so isolated.
You know, I just wanted to connect with MP Turnbull because he's very much into social enterprises. And I have to tell you that with a little bit of funding from the government, we've had so many organizations take that funding and turn it into very powerful mechanisms to help seniors, not just, you know, with connectivity, but also with programming and to be able to connect with providers of internet so that they got special payments, very low payments for seniors to be able to take advantage of these programs and opportunities within the community. So everybody's working together, and it has been a really inspirational year to see how many people have stepped up, how many companies have stepped up, and how many seniors have now been able to access services in different ways that they never did before. And it's opened up a world of opportunities for those very creative and innovative you know, community leaders to be able to even do better services as we move forward. Yeah.
Madame la Ministre, si vous aviez
Madam Minister, if you had a minister to give to all organizations that helped us to support the seniors, what would be your message to all these organizations who were able to adjust and create all these new programs in the social field? What would you say to them?
I cannot thank them enough for stepping up. And that is not just organizations, not-for-profits, and individuals. So many people have come forward and volunteered their time and their resources, and companies donating food and you know, stepping in to be able to give seniors little care packages. Just so many people stepping up and coming forward and providing meals to those support workers in these long-term care homes that have been working. They're angels, what they've been doing and what environment they've been working through in both our hospitals and in our long-term care homes. And even people often forget about all those that are serving seniors in the home care system. And the last thing is our caregivers. You know, we have so many families that are working so hard to support their loved ones. And I think everybody just needs a big communal hug and a big thank you to everyone for stepping up. And we're going to get through this. We're going to get through it together. Thank you.
Thank you very much, Minister. Merci, Monsieur Lauzon. Minister, that's a very nice note to end on. Thank you so much for being with us. And we do appreciate you getting in to discuss the estimates with us before they were deemed to be adopted, and you did that. We're grateful for your time, and we're going to move now to hear from officials. So, Minister, you're welcome to stay, but you're free to leave. We're going to suspend for 2 minutes while we let the minister disconnect and welcome one more witness before we recommence. So we stand suspended.
Thank you, everybody. I'm off to
one additional witness, Leisha Ram, Associate Assistant Deputy Minister, Skills and Employment Branch. Welcome back, Mr. Ram. We're going to get right into questions, beginning with the Conservatives. Ms. Falk, please, for 6 minutes.
Thank you, Chair. And thank you to the department officials for being here. Long time no see for almost all of you. So it's nice to see you again. I want to follow up on a question that I had previously regarding supplementary estimates and the allocation of just under 12.5 million. And these were funds for personal support workers, training, and measures to address labor shortages in long-term and home care. So from what I understand from the previous meeting, this hasn't been, no funds have been given out or very little funds. Is that correct?
Thank you, Mr. Chair. I can certainly respond to that question, and thank you, Honorable Member, for the question. So we are working actively to get those funds out and running. We expect to make an announcement in coming weeks. Certainly, it's taken us longer than we would have wished, but we're confident that we'll be in a good position to get that money out working and getting more people trained up.
Okay, thank you. What are the expected outcomes of this program?
So we're looking to train up a significant number of new personal support workers, as well as to get some better quality training materials.
Do you have, does the department have a specific estimation of how many workers?
So we are still finalizing those numbers. And as I said, we hope to be making an announcement in the very near future.
Okay, and so then I assume also within that announcement there will be determine or what the parameters are, I guess, for applicants, and or can you divulge that information now of what the? Oh, go ahead.
So that information will certainly be part of the announcement because we want to be sure that people who are interested in the training are going to be able to have access to it.
Okay, thank you. The CRA's website has a disclaimer on the webpage that there are processing delays for paper income tax returns, and this isn't something new. We've definitely heard about this, especially in the House. We know that many direct financial supports are linked directly to seniors filing their income tax returns. So I'm just wondering, does the department have any indication on the scope of these delays? And how is ESDC working with or coordinating with CRA to ensure that no senior loses their benefits due to processing delays at CRA?
I could take that, but Cliff could develop more. But like it would really affect seniors on the GIS. As the minister mentioned, usually we update the payments on the GIS in July, based on the income of the previous year. And this year we have postponed this because of the pandemic and also later return at CRA that was allowed. We postponed to exceptionally to December before we would update those for those who have not filled the tax form, being paper or not. We have delayed until December. And we are right now in contact with those that have still not sent us the information on the GS side by phone, by letter, and we offer them too that if they couldn't fill their tax form for any reason, they could still provide their information on their income of last year to Service Canada for a simple form, and they would be put in pay. And right now they're still in pay at the same level than they were last year, so we didn't change their GIS payment.
Will payments be cut?
If by December we still don't know the information, they will, but they will be put back in pay as soon as they get back to us about their income.
But what if that's sitting? What if that's sitting on a desk of a CRA agent? I mean, it's no fault of the seniors their own if they've sent it away and it just hasn't been processed yet. I don't think it would be fair to penalize seniors who are already vulnerable, especially in the state of this pandemic, by cutting their benefits if it's sitting on a desk of a CRA agent.
As I said, we are, Cliff could give you more details, but we are in communication by phone and letter to these people. And so if they have completed the tax form and it's sitting at CRA, they would be able to tell us that, and we would put them we would adjust their GIS according to that information. So I don't think that kind of conditions are going to apply, given the effort we made this year to connect with all these seniors that have not yet.
Has the response rate been good? Like, I'm assuming correspondence has gone out already because it's practically December. Has there been response?
I've been myself impressed, and I will ask Cliff to give you the exact number.
Certainly. Thank you very much, Benoit. The response rate has actually been very good, and we're very pleased to confirm that this year will be by far the lowest number of GIS recipients who may be suspended than in any other previous year. It has been because of significant outreach that we have done. There's approximately 40,000 clients who we have not received income information for, and we've actually sent them additional letters and done telephone calls out to all 40,000 of those individuals. And so we are very pleased with that outcome. And as Benoit indicated, they do not need to file their income tax as long as they give us their income tax information.
Okay, thank you. Mr. Raum, I just have a quick follow-up from my previous question. The minister had mentioned that Red Cross will be training PSWs. Is that tied in with this budget line expense or estimate, sorry? Is that part of that program?
It is not.
Okay, that's separate.
Thank you.
Okay.
Yeah. Thank you, Ms. Falk. Next, we're going to go to Mr. Long, please, for 6 minutes.
Thank you, Mr. Chair. It's great to have you back in the seat. Mr. Kent did an admirable job, but it's good to see you back. And certainly I want to thank all the department officials for being here this evening, and just want to make a comment that, you know, the work that you've done as a department looking after Canadians, especially through this historic pandemic, is really been noticed and certainly appreciated. So again, thank you very much. I'll ask my questions maybe through Mr. Robideau, and maybe you can direct them to the appropriate person. Look, there's no question that seniors are, you know, one of the most vulnerable groups that we have in Canada, and that was clearly evident through the pandemic. You know, whether it was the GST or $300 or the $200 top up, if you got the GIS, was so appreciated. But I just want to focus also on retirement savings. So the first question is, how has the COVID-19 pandemic affected the cost of living for vulnerable seniors and their retirement savings? And that could go to you, Mr. Robideau, or maybe Mr. Conrad.
I could take it, sir.
Sure.
Thanks for the question.
Of course.
Again, in terms of retirement saving, they have been affected by lower rate of return, like every other Canadian potentially. So that is affecting them. In terms of cost of living, again, although the inflation has not been very strong, some of the components of the cost of living, like food, have been quite strong in terms of price increases. So they have been affected by that, and more, I would say, more than maybe some other population that the rest of the population, sometimes that's used, for example, more transport, for example, where the cost has been going down because of the fall in the price of oil and gas. So overall, I would say that they have been potentially more affected on the price side. Again, affected generally on the rate of return. And in terms of what the government has done for those seniors that have to take part of their retirement income out of their savings account every year, they have reduced early in the year by 25% the amount that they had to withdraw from the account, which allowed them to preserve more of their savings if they didn't need the income for this year.
Are you able to give me some comments on how the department, the government's monitoring the issue? And do you have any data on this issue?
I don't, and I don't believe we have. This is a program that is managed by the Department of Finance, and I think it would be a good question for them to know if they have monitored the withdrawal this year. I would say probably they are even them not in position to answer that, because we're still not close the year, so it will be more after this year that maybe there will be a possibility to get into the data to see through the data that Stats can release how much seniors have reduced their savings compared to other years.
Okay, well, that'd be good to know. Thank you very much. Next question is, elder abuse has been on the rise during COVID-19 pandemic. How, if at all, has the department changed the way it assesses needs and delivers assistance to help reduce elder abuse during this pandemic?
Well, as the minister mentioned, the main tool we have, again, we supported provinces to a large extent. We provided financial payments, but also with the one-time payment to seniors with GST credit that many seniors benefited from. But again, through the New Horizon for Seniors program, we have elder abuse as part of the priorities for people in community that receive funding through the Penn National stream or the community stream that is more well known. And so that's the main channels by which we're trying to provide to community that goes after these different ways they could help senior to avoid elder abuse, to be supported. And as the minister mentioned, we had like the government has stepped up the program overall once by 20 million from 50 million first permanently. I can't remember the year exactly, but probably 2018-19. Then they have we have added at the beginning of the year with the help of United Nations 9 million, then another 20 million. So a lot of funding going through New Horizon for Senior program to try to do our best to support communities that helping seniors to avoid elder abuse.
Okay, thanks for that. I just want to switch off to and just focus in on mental health for seniors, especially vulnerable, isolated seniors. I certainly see it daily in my office here in St. John Ross. We get calls from seniors that are isolated, lonely, and again, I think we all can agree that mental health for our seniors during this pandemic is a major concern. So, are you able to tell me what data and information the department has gathered on mental health of seniors during the pandemic?
I don't, but I will ask Alexis if he has any information on that or any other officials on the line.
Yeah, thank you. No, I'm not aware that the department specifically has collected data, but certainly Health Canada and Public Health Agency have been collecting data from various resources of the impacts of the pandemic on Canadians' mental health and specific subgroups, including seniors. If the committee would like, we can follow up and try and gather some information on that front.
Okay, that would be appreciated.
Thank you, Mr. Long.
Thank you, Chair.
Maintenant, Madame Chabot pour.
Now, Ms. Chabot, you have 6 minutes. Good evening, everyone. Thank you for being there. I have a question regarding the guaranteed income supplement. There's a special COVID amount, the $200. There are many cases or situations where people have applied for it well in advance, but they never received that amount because they were not, it was not processed in time by the department. Have you provide for special measures at Service Canada to handle those measures and to improve the situation, and how much it would cost to do so? I'm going to ask Cliff to give you the answer. Thank you very much for the question. In order to deliver the special payment for seniors, either for people who receive OAS or the GIS, we were able to organize processing of all applications that we received, and it's being handled in our processing centers. We process them on a priority basis, and we're going to make sure that as much as possible, the people who are eligible for those payments would receive them. That is why we, first of all, issued one payment in July, because the payment was eligible for people who were eligible starting in June 2020. And then after that, a second payment was issued for people who were, it was processed between July and September 11th. So there may be, I'm sorry, but my question was, that there are people who applied within the timelines, and it's the processing done by Service Canada, even if the application was done within the time period, and they were not processed as of September 11th, and the answer given was it was not processed on time. That was my question. I understand that those people are still falling between two chairs and have not yet received this benefit, and it's quite unusual for them to be the victim of a processing delay, whereas they respected the timeline in making their application. So I hope that corrective measures will be taken. Have you ever considered this? It's another question. That instead of, well, there are a number of seniors who are entitled to the GIS who do not sign up for it because they're not aware of it. Why is it not made automatic when you know very well because it's based on their previous year's tax return? Ms. Chabot, yes, as a matter of fact, we do add payments for GIS for a number of seniors that have been doing so for a number of years. We have a program for that, but we don't have enough information, and we can only start the payments as of 65. After that, if they fell through the safety net, people who are more than 65, then it's more difficult to set them up for the payments if they don't agree to fill out the form. And we're in communication with them on a regular basis, and we have a sample of people who are probably eligible and for certain GIS payments, but they don't apply for it, and we send them letters to apply, and then I can return it to Cliff if you can add to that. We have developed new tools, and for people who can apply with a form and with GIS, and for OAS, not to have two separate forms in order to simplify things for them. So for new seniors who have reached 65, it's much simpler than it used to be because of the improvements that we made, but it's still difficult to set people up for payment if they're over age 65 and if they're eligible.
No, it's okay because I have another question. I would like to talk about contribution. In the main estimates, there is a fund of $1.8 million to organize a project to fight fraud towards seniors. It's a different amount in 2019, 2020, so why is it less? I don't know. But could you tell us what was the result of these contributions? Did many initiatives were funded to fight fraud? Because we know that during the pandemic, it was a big problem. I'm not sure I understand your question, Ms. Chabot. What program are you talking about? Are you talking about the subs B, or are you talking about something else? It is a payment to fund projects that will reduce fraud and abuse. It's in subs B. In the main estimates, it's $1.8 million. I will ask Mark. I don't know if he has any information on that because I'm not sure what you're talking about.
What we're talking about?
Yes, it's part of the new. It is part of the New Horizon for Seniors program, page 267 of the main estimates. So I don't know if we have any results for that one though.
So we'll get back to you, Minister, Madame Chabot.
We will get back to you, Ms. Chabot, because I am not sure what we were talking about, so we'll get back to you. Thank you, Ms. Chabot. Now,
Dan, please, for 6 minutes.
Thank you, Mr. Chair, and I'd like to thank everybody for being here today. In my riding, I have many seniors who are part of the shelterless community. Many seniors that are part of the shelterless community as a result of complex mental health and trauma issues, as a result, for example, of being a veteran and the PTSD that comes from experiencing war, or, for example, many residential school survivors who are currently now shelterless. This is disgusting, particularly for seniors who we always talk about should always be able to live with dignity and human rights. Has your department explored ensuring to increase the GIS benefit to be livable so that all seniors, no matter where they're from, can live with dignity and human rights?
Thank you for the question. I fully agree with you on your point that they have to live in dignity. And again, the government has increased the GS once for single. Those are the most affected by that. And I could assure you that we're always looking at options to improve the financial security of seniors and
sorry,
options.
With all due respect, I really need an answer. Like, is your department committed to ensuring that benefit is livable? I'm not talking about, I mean, we can all agree that we want seniors to live in dignity, but how we demonstrate that is just not happening. So my question is, will you ensure that the GIS is increased to ensure that it's livable so that all seniors in this country can live with human rights and dignity?
As a civil servant, I could assure you that we're looking at options to help in that direction and to propose an advice in when possible in that direction.
Okay, so that's a maybe. I felt like that was a non-government response, with all due respect. Okay, my next question is in regards to pharmacare, a single payer pharmacare system and a universal dental care system. We know that seniors, as I've indicated, have been some of the hardest hit during the pandemic, and really the one-time payment of $600 doesn't cut it, particularly with the former example I used about many seniors being shelterless. That is a tragedy on the watch of this government. Can you speak to the importance of a universal single-payer pharmacare program and a universal dental care program as life-sustaining measures for seniors?
Well, pharmacare is really there. You know, as you know, the government wants to move forward on pharmacare. It's part of their commitments. But I couldn't speak to pharmacare. This is the file of the Health Canada, and you would have to direct that question to officials from Health Canada.
Sure, fair enough. Long-term care homes. We know, I mean, I spoke or asked questions while the minister was here about deaths in long-term care homes, you know, providing extra support for those seniors who want to live at home but do not have proper support. She was unable to really give me a dollar amount of the money that's being invested to ensure that seniors can live at home. I'm speaking specifically of examples in my writing where seniors are wanting to leave long-term care homes because their life is at risk, but they do not have the resources needed to live at home.
Thanks for that question. As the minister mentioned, the government has already moved forward on the home care, which is somewhat different to the broader idea of living at home and be supported for that. And you know, we read the speech from the throne, as you probably did, and I could tell you that we, since the speech from the throne has been released, we're working on options for the government to advance that commitment.
When will that be done?
I couldn't tell you that.
Just because like people want to know when they're going to get support, because we certainly in my riding, I've had a lot of seniors perish in the last couple of months who have no options. They are not disposable. And I think, at least a timeline, do you have any sort of sense at when this will be done to ensure that we can assist seniors in being able to survive the pandemic?
Again, the only thing I could second tell you specific timelines, but I could tell you the government has announced that in the speech from Trump, because clearly it's a priority for the government, and that we're working on option, and we're doing our best to do as quickly as possible to devise option that.
Thank you, Ms. Kazan. Thank you, Ms. Kazan. Thank you, Mr. Robidoux. Next, Mr. Kent, please, for 5 minutes.
Yes, thank you, Chair, and thank you to all of our witnesses this evening. The Minister mentioned in her remarks that to fulfill her responsibilities to seniors, she often has to work horizontally with other ministers in their departments, employment, labor, families. I'm just wondering how seniors with disabilities, working seniors, or those who were working before COVID, and those not, how seniors will benefit from the government's recently announced disability inclusion plan, particularly given that they've been hard hit by the pandemic.
Thanks for the question. Well, the plan again on this in the speech reform is pretty detailed and comprehensive. So a person with disability would be in principle supported by a new benefit. Clearly, seniors would benefit. Seniors with disability would fully benefit from a new benefit that would, with other benefit, get into not a guarantee income, where would kind of continue the building blocks of a guarantee income by pieces. So there's that. There's also an employment plan and training plan for persons with disabilities, which would help some seniors, mainly the non-seniors, but could help some seniors too, to be able to work if they are able to, with some support that they would receive. Often they face, like other person with disability, barriers to access labor market. And finally, the third part of the plan is to ensure that the delivery of benefits is streamlined, more accessible, and again, the seniors with disability would clearly benefit from that.
Now, details of the plan haven't been rolled out. What's the timeline? What should seniors be looking at in terms of their expectations?
Well, I have the expert with me, Alexis. I will turn to Alexis to give you his best guess on when.
Thank you, Mr. Chair. I can't trump the minister by giving a date on when the government will make a major announcement, but I can tell you that certainly Minister Schulte, who you spoke with, is very much supportive of Minister Qualter's efforts around a Disabilities Inclusion Action Plan, and has strong commitments in the speech from the throne and a strong ambition. She has engaged the community. She has Minister Qualter has a disabilities advisory group, and she is very keen to move forward as many of these initiatives as soon as possible.
Fair to say
I would
soon?
I would say as soon as possible would be her view.
Okay, thank you. Now, we've seen that the belated delivery of the $600 one-time payment to the 1.7 million or so certified persons with disabilities originally left out more than 6 million people living with disabilities who weren't certified, but who are now told they can apply. Given that a significant number are seniors, should they now be certifying themselves in expectation that the still undefined disability benefit modeled on the GIS will be available to them?
Alexis, do you want to answer that?
Sorry, now identify themselves through government programming as eligible as having a disability, so they can take advantage of a future benefit. Absolutely, but our expectation would be that the government provides significant supports already. Mr. Chair?
But should they be certified? I'm asking, is it wise for them to be certified, or will they be sort of off in that area where, with regards to the $600 one-time payment, folks are now scrambling before the end of the year to apply to qualify that?
Well, I would say we would encourage anyone who's eligible for a tax credit or government program for disability to apply for it, because they are there to support them. And that, regardless of a new benefit, I would encourage them to do it anyway. But if they are in the system, then we know they have a disability, and it becomes easier later.
Okay, thank you. Do I have time for a very short question, Chair?
You do. You go right ahead. I owe you.
I'm just wondering when the New Horizons program for the next year will open. December is the usual date. It wasn't last year, and we've had a very unusual year this year, but do we have a date for the opening of applications for Horizons, or for Canada Summer Jobs?
Canada Summer Job or New Horizons for Seniors, or both?
Well, for both.
Okay, well, I have Stephanie Hebert with us. So Stephanie is managing both implementation of these programs, so she will tell us.
Thank you very much, Mr. Chair, for the question. So 2 points. So on New Horizons for Seniors, a thank you to members of Parliament for all of your assistance in promoting the call. As you know, that call recently closed in October, so we hope to be able to come back to you early in the new year to be able to advise you of the organizations who we are recommending for funding. But we really did get an overwhelming demand, and so we were quite pleased by that. With regards to Canada Summer Jobs, members of Parliament will be aware that we are currently engaging with you right now. We are working with you to set priorities in your respective constituencies. Those priorities will inform ultimately when we do launch the public call for proposals. As my colleagues have noted, we never want to scoop a minister. And so once that date has been announced, we will be able to share that. But I am happy that we are starting to work with you. So that should give you an indication that we hope to launch it very soon.
Thank you.
Thank you, Mr. Kent. Next, Ms. Young, please, for 5 minutes.
Thank you very much, and thank you to all of the department officials for being here tonight. This has been a very interesting conversation and a lot of information gathered about seniors. And as we all know, not all seniors have the same needs. And I think it's evident in just what this committee is doing with Indigenous housing. And we're in the process of taking a really close look at urban and rural and northern Indigenous housing needs. And within that would be seniors' needs. And I wondered about in the supplemental estimates, there's allocations including funding to co-develop a holistic long-term care strategy with First Nations and Inuit partners. And I wondered if you could expand on that and tell me how that actually will happen and how Indigenous people will actually benefit from this portion of funding.
Thank you for the question. This is really, I would love to develop a bit more, but it's not a file that we in the department control directly. It's really in between CMHC and Indigenous Services Department, and I think it would be a very good question for them. But I know they're working for years to try to develop that approach, and I'm sure they will be quite happy to come and explain to you. We could, yeah. So I would, CMHC is really in charge of that file, and I don't think anybody on this panel could really give you substantive information about their plan.
Okay, that's okay. It's just something that I was very interested in, and I will take it to someone else. But when you talk about seniors in the National Housing Strategy, how are they reflected in that? I know the minister talked about that briefly. Can you reflect on that?
I could. So we we meet often with our colleagues at CMHC about the National Housing Strategy. The minister is also connecting with them. So we always talk with them, and we always try to whatever new measure they bring to have a lens of seniors in their new investment. We were talking about in the when the minister was there about long-term care facilities and what could be done. We work with them to try to ensure that funding was available for the capital spending. So we always work with them on that, and often they would come with a carve out for seniors, or include them for sure in the approach they're taking. So we're always working with them on that to ensure that there's a lens for seniors in their approach.
Thank you very much. And we did briefly mention the extra flexibility with the registered retirement income funds. And that was welcome news for a number of seniors because, of course, reducing their withdrawals really did help, especially this year. Do you see that extending into the next year as well?
And it's very hard for me to tell if it would be considered, but let's say that I could just say if the pandemic keep going the way it is, I think there's many things that may be reconsidered again, or at least we'll look at them for sure in the future if the pandemic continues.
Yes, and as we know that we are hopeful that the next couple of months will turn the corner with the COVID pandemic. But you mentioned earlier about different options. Are those options certainly have changed because of COVID?
Well, they're always influenced by the level of the pandemic and the direction of the pandemic in our thinking. Always, as it's been since March. Again, we explained that to the committee before on the service.
Monsieur le Président, appel au règlement.
Point of order, oui, Madame Chabot.
Merci. Écoutez, je laissais.
Call to order. I highlighted, but it's the second time that the interpreter says that they can't interpret because of the sound. So, the person who is speaking has a bad microphone, so could you please take care of this?
Get some guidance from interpretation. Is there a problem with one or some of the microphones? It appears that Madame Chabot isn't getting the English translation.
Perhaps, sorry, this is the clerk speaking. Perhaps, Mr. Robidoux, if you could hold the microphone a little bit closer to your mouth, the sound would be better. It is fairly quiet in the room as well.
I will.
Okay. Merci pour ça, Madame Chabot.
Thank you, Madame Chabot.
We're in the middle of an answer. If you could just complete your answer, and then we're going to go to voting on the estimates, I think. Go ahead, sir.
Thank you, Chair. So I was just saying that when the pandemic struck in March, and we were working on the CERB, we had to change very quickly, week by week, the design of the benefit and the scope of it. So I think we all at TSDC a bit in the pandemic mode still, and thinking in the same way, and it's always influenced by the dynamic of the pandemic. I could assure you.
Thank you very much, Mr. Robidoux.
Thank you, Mr. Robidoux, and thank you, Ms. Young. Colleagues, we need to leave it there because we do have some committee business. This being the last date for adoption of the main estimates, we actually have to put them to a vote. So at this point, I'm going to bid the witnesses adieu and say to each of you how much we appreciate having you back. We appreciate your patience and your professionalism. and the fact that it's very important that you don't trump the minister. We understand that your role is to provide fearless advice, and the efforts that you have made to guide the government, guide the ministry, and guide the country through the pandemic have not gone unnoticed, certainly by the people in this room, and I think the country as a whole. So thank you so much for being here, and thank you for the work that you do every day. Now you're welcome to stay, but you're free to go. Colleagues, we are bumping up against the deadline for the reporting of the main estimates, so we need to go through a couple of formalities. My question for you, is it now time to call the votes referred to us under the main estimates? And is there unanimous consent to consider all votes at once?
Yes. Yes.
Excellent. Shall all votes, thank you.
Yes.
Referred to the committee in the main estimates 2021 carry?
Yes.
Carry. I see consensus. Shall I report the main estatements 2021 to the House?
Oui.
I see. Okay, it's carried on division. Thank you very much for that efficient dispensation of that business. Next meeting is December the 1st. If there's no other business, I will adjourn the meeting. Do we have consensus to adjourn?
Agreed.
Believe I see it. Have a wonderful evening. Mr. Kent, look, thanks again for pinch hitting.
Good evening to all.
Always ready, and I saw you in the aircraft this morning when the House opened. So I thought